points that people could refer back to. Why did you bypass all of this and just come down with a decision before the panel could meet and make that data?
That panel has been a kangaroo court where they just rubber stamp every single vaccine put in front of them. If you look at the minutes of the report from, they even say we were generally want to move towards a risk stratified approach.
So why not let them do that in June?
So in the meantime, we don't want an absolute recommendation for healthy kids to get it. They can do it, and that committee will meet and make recommendations. But you look at the minutes of the last couple of years, they say we want a simple message for everybody just so they can understand it. It was not a data-based conversation. It was a conversation based on marketing and ease. And I've written an article titled "Why the People Don't Trust the CDC," and it's in part from that blanket strategy.
Well, you're kind of telling them not to right now. You just said don't trust the CDC.
We're saying it's going to be between a doctor and a patient until that committee meets or more experts weigh in or we get some clinical data. If there's zero clinical data, you're opining. I mean, it's a theory. And so we don't want to put out an absolute recommendation for kids with no clinical data to
So you
support
made
it.
this pronouncement as well on pregnant women. There is data. Researchers in the UK analyzed a series of 67 studies, which included 1.8 million women. And the journal BMJ Global Health published it. People can Google it at home. And it says the COVID vaccine in pregnant women is highly effective in reducing the odds of maternal SARS-CoV-2 infection, hospital admission, and improves pregnancy outcomes with no serious safety concerns. This is data that shows that it is recommended or could be advised for pregnant women to take this vaccine. Why do you find otherwise?
There's no randomized controlled trial. That's the gold standard. Those 67 studies are mixed. The data in pregnant women is different for healthy versus women with a comorbid condition. So it's a very mixed bag. So we're saying your obstetrician, your primary care doctor, and the pregnant woman should together decide whether or not to get it. 12% of pregnant women last year got the COVID shot. So people have serious concerns, and it's probably because they want to see a randomized trial data. The randomized trial in pregnant women.
The world moves on. And you published in the New England Journal of Medicine on May 20th, in that report you referenced, you listed pregnancy as an underlying medical condition that increases a person's risk for severe COVID. You said that. So then 7 days later, you joined in this video announcement saying you should drop the recommendation for the COVID vaccine in healthy pregnant women. So what changed in the 7 days?
In the New England Journal of Medicine, we simply list what the CDC has traditionally defined as high risk, and we're just saying decide with your doctor. We're not saying one way or the other. And the randomized
data
trial,
and information as well from you and your.
So here's the data on pregnant women. A randomized controlled trial was set up and it was closed without any explanation. We wanted to see that trial complete so women can have information that in a randomized controlled trial, which is the gold standard, this is what the data shows. We don't have those data.
All right. It is still unclear what pregnant women now should do until they get the data that
I'd say talk to their doctor.
When do they get the data you're promising? All these controlled studies.
In the absence of data, they should talk to their doctor, and their doctor will use their best wisdom and judgment.
FDA Commissioner, thank you for trying to help clear this up. Up next, the potential impact of those new policies regarding foreign student visas. We'll be right back.